And then Betsy.
Aye.
So I'm trying to be very clear because I actually serve on two panels here. I'm on the NIH working group and this one as well. And I'm not clear. This panel is looking for a clinical, not research
Correct.
case definition.
Correct.
Because and we're not talking about clinical research, we're talking about clinical as in the practice of medicine clinical.
This is for people who, this is for this could be researchers who also see patients, but this is basically for the doctor or the nurse practitioner or the PA or, you know, other health providers that somebody walks in and it's for them to help this person who has this diagnosis that they're not quite sure what it is, that they have these symptoms. So it's not, the research information may come out of this. You all may decide that there are some interesting questions that could be answered with a couple of studies. But this is really for helping patients get the kind of care they need from their healthcare providers.
In a clinical sense, subgrouping would also be addressed.
Subgroups are good.
Hi, I have a question about the charge of ultimately creating a set of criteria that will help with the diagnosis, and that's part of our statement of tasks that you just described to us. Can you explain why HHS pretty much stopped there when you just acknowledged that it's very difficult for patients to find providers, physicians who are familiar with the illness? Are there any plans for HHS to extend that so that there is some way that we can provide a website or something for patients to find qualified providers to treat the disease?
I think that the government doesn't generally endorse individual providers. So we came to the IOM because we needed the expertise that could be gathered and the process that could be gathered. When we have the recommendations that you all provide to us, we will put that out and we will work with the advocacy organizations that are around the table, around the room here. We will hopefully work with the big professional organizations, ACP, AFIP, Academy of Pediatrics, to push it out from that way. But we don't have the product that we can push out yet. And there we have a work group right now that's part of our Chronic Fatigue Syndrome Advisory Committee that's looking at educating primary care providers about ME/CFS. And so they're going to be developing recommendations that will go to the secretary in that regard, which I think is about increasing the workforce. A lot of that is outside of the realm of the government because the government doesn't put out people's names on, providers' names on websites.
Right, I understand that. I'm just concerned about getting this information out in a way that is accessible, in some format that's accessible for patients, because we're way behind the 8 ball with that,
right?
As you know.
Right, and so that's I think, the task 4 is for you all to help us work through that. We have the advisory committee that can help us with that as well.
Task 3, I think it is to address the name. Yes. There's been a tremendous amount of public discussion on this, that the CFSAC minutes would reflect many, many, many hours and months and years of discussions and workshops and so on this. In your mind's eye, is there a role for additional public input?
Absolutely.
And I say, in my mind, I split it into 2 things that I think we'll hear again and again and again, the testimony about the name being harmful. And but what would be very helpful to the committee is constructive advice or thoughts on how to go forward. Not so much as to spend many, many, many hours discussing what's already out there, but rather, where do we go from here? And is there, in the most evidence-based way, a way to go forward? And there, as a committee member, I'd welcome a public input.
And I think that we really look to the stakeholder advocacy community for suggestions and on that task.
So on that same, but I don't understand a mechanism of how that would happen. So today we have this public testimony, and I'm sure it'll be very useful. And can we use some innovative way, blogs or I'm asking us, the IOM staff, is there some way to have the input of the public as the process goes on various elements?
Yes, we have established a project email, and we have received comments that we deliver to you that you have. And this email is going to be open through the whole process. So it's an email where they can submit. There's no deadline for submitting. So we will have that as a regular means of communication with the public.
I just wanted to append to Nancy's comment. I think we had talked a little bit in our session in the morning about how we as a committee, we're going to talk further about how public input will be gathered or put into the final documents.
I was going to say, thank you, Dr. Lee. That's very helpful. I confess that if we get through the federal presentations sooner than anticipated, that gives us more time for public input. So I'm not too sad about that. But thank you so much.
My pleasure.
And you've certainly given us a lot to chew on. Our next speaker is Dr. Elizabeth Unger, who is the chief of the Chronic Viral Diseases Branch for the CDC. And she is going to talk about the methodology for the CDC multi-site clinical study.